Usually in our channel we talk about arm wrestling training and strength conditioning and strength training, but we receive a lot of emails and questions about injuries, and then somehow we realize that I'm more than 15 years working as a physiotherapist, and so today we will talk more about radial nerve. I will not go too specific about anatomy. You can find it in internet or your anatomy books, but if you feel some pain or numbness or swelling or weakness in triceps region, in the back of your arm, in back of your forearm, where goes wrist and hand extensors, weakness in rotations, pronation, even supination, if you feel some weakness and pain, also numbness in your thumb, index fingers, those 3 fingers, it's all could be by radial nerve. And I will show you just a few exercises, few tips I'm showing to my patients, which want to mobilize, glide, or you can call it as a nerve flossing, mobilizing, even nerve stretching exercise for radial nerve. First very basic would be lift up your arm when you start to feel some little stretching. It's not only for radial nerve, it's actually will mobilize a little bit as well, other nerves. And you do wrist extension and wrist flexion. If you feel too much tension up here, do it lower, do it here. Full range of motion. I would say if you do just one exercise, it's enough with 10-12 times. If you want to do all those exercises, sometimes to not irritating too much nerve, you can do just 5-6 repetitions of each exercise. But if you are lazy and do just one, do more, at least one. Second would be arm flexion. Do internal rotation, so you stretch more front of arm and then flexors. Lift up your arm so you feel some tension and stretching. You lift your arm away, keep rotation, back or straight with arm, rotation back. Again, internal rotation, external rotation. Arm stays in flexion. Sometimes you can do the same thing and opposite. Internal rotation, arm internal rotation, head goes to arm side, external rotation, head goes away. Internal rotation, external rotation. Put arms together, lift up, stretch down, lift up, stretch down. How it's called, water pump, or yeah? and you can do same movement, lift up here, down, lift up here, down, and you can hold a little bit to stretch again this back of the arm or back of the forearm. Easy and effective exercise for radial nerve gliding is just to do with your palm, circles on your back. I can show you. With your left arm it should be done clockwise. Same with right arm, counterclockwise. Do circles on your back. It's like I said before, if you do all those exercises, it's enough with 5-6 repetition of each exercise. If you do it just one exercise, you can do 10, 12, sometimes a little bit more. But don't go too much, don't irritate that nerve. If you feel some acute pain, if you feel worse after that, don't do this. Sometimes do less. It's not often that I'm saying do less, but with nerve it is do less and do again tomorrow. Do it regularly, but don't do too much. If we talk today about radial nerve, then we can't forget that radial nerve comes from brachial plexus, and compression which can give similar symptoms could be that your pectoral minors or your pectoral muscles are chest muscles are too contract, and nerve goes under this pectoral minor muscle. And the easiest way to fix it is You have to stretch your pectoral muscles, stretch your pec minor, keep your shoulder down, put your arm up, do some rotation, hold for 5-8 seconds. I would say relax, stretch again, hold. Sometimes you can do even small movements here. So feel some stretching here in a chest region. And which goes opposite, you need to activate your latissimus muscles. Very often one is to contract, other is underactive. So best exercise for activating lat muscles are all pulling movements. Shoulders goes up, scapulus goes up, you pull down shoulders, you get your scapulus closer. You can do the same with rubber, standing, sitting position. Activate your lat muscles. It can help a lot in your radial nerve problems. Stretch your chest, activate your lats. I hope those tips will be useful for you, and better don't be doctors yourself. If you have serious problems, find some physio near you, find some specialist, and if any exercise make symptoms worse, better find specialist. So take care, get strong, love arm wrestling, and be healthy.